committee meeting to order. Issue number 1, Board of Supervisors authorized budget allocation from contingency fund for rabies program expenses.
So moved.
Second.
Motion and a second. Discussion. Vicki?
I discussed this briefly at the last committee meetings last month. Rabies program. As I said, we get a grant for $9,442 to cover our rabies expenses. I always include another $10,000 in our budget because we always overspend our grant. And this year, in the month of April alone, we spent $19,500, a little over. We have not necessarily an unusual year, the fact that we've had people that have exposed. The problem being the people that we've had exposed do not have insurance. And it's the luck of the draw on, who gets exposed and whether they have insurance or not. The medication is very expensive, as you can see. And I would just say that most of our people go to Geneva General Hospital for the post-exposure, and they have cut the price less than half. So imagine what that would be if we had to pay full shot. But we need the money to cover the expenses. The program we have no control over. I cannot control who gets exposed. Cannot control whether they have insurance or not. People that don't have insurance are certainly referred to a facilitated enroller or someone that can help them enroll in insurance. And unfortunately, some people opt to just pay the fine and not get insurance. But bottom line is we need to cover the expenses. So I'm hoping that $20,000 will get us through the rest of the year.
Are there any questions from the committee, Mr. Kaiser?
Clarification. I never would have thought there was that many people. Did you just say a number of people, average, that we have to treat with this?
There's no average. I mean, some years we haven't had to do many. I think this year, the three expenses that we have for the $19,000 were 3 people.
Wow. That expensive.
It's very expensive. The immunoglobulin is what the expensive part is, and then there's a series of shots which are cheaper, but it's very specified, the program. Day 1, day 3, day 7, it's a whole regimen. That part is cheaper, but it's very expensive.
It's not, relatively speaking, there are a lot of people demanding that product, so therefore what little is out there nationwide is not a lot, so that's why it must be so expensive.
Well, the immunoglobulin is expensive for any kind of illness, and we had hepatitis A, and the immunoglobulin for that was what was so very expensive for that too. Because of the antibiotics that you have to give the immediate, and that's the concern with rabies. You want to give the immediate response. You don't want it to go on.
Fine, I never would have expected it to be that expensive. Thank you very much.
Any other questions from the committee? Any questions from the board? Now, if we had a motion and a second, all in favor? Aye. Opposed? So moved. Move on to issue number 2. Board of Supervisors authorizes and directs County Manager to sign a contract with the New York State Department of Health for the lead poisoning prevention program grant.
So moved.
Motion?
Second.
And a second.
Okay, this is a continuing grant that we get from the State Health Department every year that helps us pay for our lead program expenses. We do some lead testing in our clinic. We do promotional activities, a lot of public education, and this helps offset those costs.
Any questions from the committee? Any questions from the board? Now, we had a motion and a second. All in favor? Opposed? So moved. Move on to issue number 3. Board of Supervisors authorizes and directs County Manager to sign a contract with S2AY Rural Health Network for consultant for public health emergency preparedness PHEP grant. Is there a motion? And a second?
I think Greg did, but I can repeat.
Vicki again.
Okay. Last several years, we've contracted with a consultant to do our emergency preparedness planning. She's indicated that she no longer wants to work with the health department. She's continuing to concentrate on hospitals. She's been doing both. The hospitals and the health departments have various divergent plans. When she does multiple hospitals, she's going to continue with them. Talked to the State Rural Health Network, and they have a consultant that we've worked with on other programs and has done emergency planning for another county, and they're are willing to contract with us. We'll be paying $50 an hour for a maximum of $39,000. It's all grant funded.
Are there any questions from the committee? Got a question down there from Mr.
Yeah,
Westphal.
Mr. Chairman, that's no big deal, but it's July 1st, 2016. It should run through June 30, 2017.
Yeah.
Just a misprint, but we'll return it to the board.
Yep.
So noted. Thank you for noticing that. Any other questions from the committee? Any questions from the board? Got a motion and a second. All in favor? Opposed? So moved. Move on to issue number 4. County manager authorized to sign contracts for engineering services for public health. Motion and a second.
Second it?
Anyway, several months ago, we talked to the board about the engineering services for the health department, and we had some discussion. There were some delays in these plans, and there were some concerns, and the board at that time recommended that we go out to give an RFP for the engineering services. Things happened. I finally got one out to RFP. I think we sent out 8 or 9 packages. We got 3 back. These are the results of the packages. The difficulty with engineering services is to try and get a price. It depends on what level of engineer does the review, varies the charge. So that's why you'll see some of these have a varying price on them, $85 to $90 an hour, $90 to $110 an hour. It varies on the level of an engineer. The gray block on the copy that I sent you, the engineering use of distribution, and the black flow, I highlighted that because that's what 90% of our plan reviews are for. So that's where we do most of it. Just a couple of comments. The first provider is located in Syracuse, so we will mail our plans to Syracuse. They will deal with them there and then send them back to us. Second bidder is in Rochester. The plans will be sent to Rochester. They'll review them. And where it comes a little muddy is they have a junior engineer review it, and then a senior engineer will review that if there's an issue. So depending on whether they're charging, they say they might not charge us for the senior engineer review, just charge us the junior engineer price. That's why the second number is in parentheses. That would be what if the senior engineer reviewed it. So it's kind of hard to muddy that, to get a definite answer on that. Also, they did include a $55 an hour charge for mailing, printing, travel, et cetera, et cetera. They said most likely they would not charge us that, but it was in the specification, so I wanted that to be included. They said, when we called them to clarify, they most likely will not charge us that, but that's not a guarantee, so I wanted you to be aware of that up front. The only other concern is with that engineering group is that they do a lot of work for the towns, so there may be instances where we cannot use them and have to send plans out to a different firm. I just want people to be aware of that also. The third engineering firm is located in Latham. Our plans would be mailed to Latham, and then they would then funnel them out to whatever office they have. So our concern with that is whether that would be an additional time frame. I don't know what the time constraint would be on that, depending on where they have to send them to get them back to us. So that's, based on this and the conversations that Tom Scholes had, our recommendation was CNS. If the board I do have the whole, packets here from the 3. If any of the committee members want to go through them more thoroughly and maybe get something out of them that we don't, I'm more than glad to do that, or if you want to look at it. That was just our first blush, our recommendation. That's up to the committee to decide more.
I'm not familiar with Latham. Where is Latham?
By Albany. Up by Albany.
Okay. I don't know because I've never heard of it. Mr. Kaiser.
Yeah, I would say say they're all good engineering firms. I would say, I would respect you and Tom's recommendation. You know what you need more than we do. Also, perhaps, I know MRB does work for surrounding communities. Perhaps, like you say, there might be times where it might be kind of like, but regardless of anything, I would respect their opinion.
I agree. Mr. Waddle?
As far as for time frame, I don't think that would be a big issue. Because, I mean, everybody either emails, they electronically send it, or they'll fax documents. You know, your review time with each firm would be your review time. And, you know, there's a considerable dollar difference between the three. And probably for most stuff that we would do, a junior engineer, I mean, the firms are the firms, and their billing structures are that. But every one of those gentlemen has a license. You know, so I wouldn't be afraid to use someone.
Cheapest one, please.
Yes. Any other questions from the members of the committee?
Vicki, I got a question. I got yelled at by a constituent a while ago that said Seneca County won't accept electronic transfers on designs and plans. Is that still true?
Most likely, because they need to be stamped and we have to have the original.
Yeah, I got reamed out by somebody there.
You can't, there's no such thing as an official computerized stamp.
Not that I'm aware.
Well, other counties do it, I was told. I don't know.
I have to look into that.
I was told all other counties in New York State do it except Seneca County.
Do what, Mr. Reynolds?
Except the electronic.
Certification.
Yeah.
I say a stamp, but I don't mean a physical.
Sign. You can have a, you can sign a document using an Adobe process, an Acrobat process, that essentially, you know, makes it
Certifies as a legal document.
certified. Yeah.
So you're talking about signed engineered plans electronically?
Like a
Signed by the engineer?
sewer plan.
But signed by the engineer?
Yeah, signed by an engineer. Seneca County will not accept one unless it's hard copy. Every other county in the state, they tell me, does electronically, except us.
So we should look into it.
He was
I'll look
screaming
into it.
to me quite a while about that, and I don't know.
Yeah.
So I'd like to have an answer on that,
I
please.
will try to find it.
Check that out.
Okay.
Go ahead, Mr. Rosero.
Thank you, Mr. Chairman. You know, just a quick question, I'm not sure, since it happens in the health department, could this happen in other departments also, where we wouldn't accept things electronically?
The problem he was having was with Tom on the one side, and then Chad Havlin on the other part, because the two were kind of going together there.
So to answer your question, it sounds like yes.
Yes.
Yeah.
That's two departments.
Yeah, he was.
I would suggest, not one to put more on your plate, Mr. Shepherd, but I would suggest that this would be a more of an issue that you should look into as what other counties do. And if other counties do accept these documents and you find it appropriate for our county to do that, I would make a recommendation that it would be implemented.
I'll track it down.
Okay, thank you.
Supervisor Lorenzetti, did you have a question?
Just no one locally then.
No, and like I said, we've been dealing with Bartlett Judith for many, many years, and they did not submit it. Yeah.
They get it.
Oh, yeah. Yeah, I've talked to them on the phone a couple of times.
Mr. Heisen?
Yes, who are the three bidders? Who are the three firms?
CNS, MRB, and CT Mail. That's the one in Latham. MAL.
So to be clear, we're looking for a motion to award a contract this evening, and your department's recommendation is CNS.
Correct.
I would entertain a motion to award this contract to CNS.
I'll make that motion. So move.
Got a motion?
I'll second. Say yes.
Got a second from Mr. Reynolds? All in favor?
Aye.
Aye. Opposed?
Opposed.
Carries 3-2. Carried. Move on to issue number 5, approval to refill vacant public health educator due to resignation.
So moved.
Motion. And a second.
And we hired a public health educator in October to fill a vacancy. Someone we created a senior public health educator position. And this person resigned in probationary period. So we need permission to do that.
Are there any questions from the committee? Any questions from the full board? Now we've got a motion and a second. All in favor?
Aye.
Opposed? So moved.
Thank you very much.
Is there any other business to come before this committee? Mr. Churchill.
Just one quick question. I hear more and more about Zika, and a week or so ago, I heard that they say it may be coming to central New York. Are we, what's the word on that?
What's the word? It'll be here. I mean, it's kind of like West Nile virus. When West Nile virus started, it wasn't here, and then all of a sudden it was here. I think it's just a matter of time. It'll be a matter of time. Pregnant women obviously are the most concerning at this point. We have information. We've got received some calls from people wanting to be tested. And it's a lot of public education and some common sense. But again, mosquito control will be very important. Standing water, getting rid of the tires, standing water, et cetera. Every resident in the county can call the New York State Department of Health or email them, and they can get 2 mosquito dunks for free. Throw out in standing water that will kill the larvae, or you can buy it at Lowe's, Chase Pitkin, or whatever. But yeah, I'm sure it'll be here. How fast it'll be here, I don't know.
But right now, New York State Public Health there's no big campaign or something.
Well, there's an education campaign. Some counties, especially down by the city, is obviously where it is right now. So they're beefing up doing them.
They don't care about us.
I say they do. I can actually speak to this. DEC was in my junkyard 2 weeks ago, and they're actively campaigning for all junkyards to not go over the 1,000 tire limit or even come close to it at this point. They told me what they'd like to see are 250 tires that have been dismounted that can hold water in their yard at all times, no more than a 40-yard container, until this situation has somewhat resolved itself or they get a better handle on it, because they fully believe it'll be here by August of this year. Well, 3 agents from the DEC I was talking to. So moving forward, I mean, they were proactive about it, and anything that contained water or any bodies of water around the facility had to be dealt with immediately in preparation for the Zika virus specifically. They were there for that.
I assume that there's probably a lot of people out there that still don't even know what it's about.
There's a lot of people, and it's like anything else. We are such a mobile society now. I mean, people are flying off all over the place and going to vacation and stuff, and some people are not using common sense. I mean, don't go to Mexico or Puerto Rico and then want to get pregnant. I mean, that to me is just common sense. I want to be tested and find out if I'm not because I want to be pregnant. Well, that's not how it works. So there is a lot of common sense and a lot of education to it. There's still a lot of, it's not going to affect me, it's not my problem until it does. And it is here, and the ramifications are nasty.
Absolutely.
Nasty. So you can avoid it by avoiding pregnancy for 2 months until you're past that danger. Does that not make sense? But
CDC is working on a vaccine, correct?
yeah.
I mean, that's where you gotta go.
Exactly.
You're never gonna get rid of mosquitoes.
Not totally, no. And, the mosquitoes will mutate, and there'll be another type of mosquito that will carry it. But again, initially right now, it's mosquito control. That's the only thing that we really know initially. Monitor the travel and the mosquito control. Get rid of them. Cut them down as much as you can, and then use protection when you're out here walking around, using the sprays or whatever.
Vicki, you just mentioned the time period of exposure that's important for a pregnant woman. What did you say?
Well, the question right now is they have found that the Zika virus remains alive in the sperm for up to 8 weeks. So usually if a woman their partner's been to an area that's endemic, whether he has symptoms or not, it's good use, it's just safe practice, use a condom for at least 8 weeks. Because right now, that's the longest time that
But
they've
if a
found.
woman is pregnant,
If she is pregnant?
and then she comes in contact during the pregnancy, did you mention?
No, I don't have
certain
time, no,
months?
I don't know, have a
They
time
haven't-
frame on that.
They haven't narrowed that down. It's
No.
not like first trimester, second trimester, nothing like that. And basically what this is, it causes a birth defect.
It can cause some nasty birth defects, correct. I mean, it's like any other thing. I may get it,
Lyme disease.
have very mild, never even know I have it. Whereas other people might become very ill. That's the problem with it. Or you might just have a flu thing and think it, there's just so many things that go into it. It's just-
But if you are pregnant, it's extremely dangerous.
If you've been exposed during pregnancy, yes, it can be very.
There's nothing you can do once you've been exposed.
There is no magic cure for it.
And does this run a course a certain amount of time? Did you say the illness itself, you become ill with it?
You may have mild symptoms and you may be very
For
ill.
a month or a week or?
I don't know.
I guess I'm gonna get my computer out and get on Google.
Everybody should.
Mr. Heisen?
Yes, Mr. Trout said, like, the most you can have is 1,000 tires at one time on your property?
Oh, yeah, unless you're part of 364, become a major collector of tires and run a tire facility like the landfill has, but to get one of those permits now, with the state, it's just not really feasible unless you're gonna go into like have a shredder there or something like that.
But they have more than 1,000 tires stored there.
Oh, yeah.
So should they be told to only have 1,000 at a time there at any one time?
Like, I think the point that they would make is they gotta go somewhere for right now, and to get them all collected into that area, if you had over 1,000 tires in anywhere in Seneca County, I'd rather have it there and then spray it, and spray it a lot.
Keep the water out.
Yeah.
The best thing to do is to shred them immediately,
Right.
but that's just not feasible.
Or keep covered.
But at least you can keep them covered, and you can spray them at least there where the landfill already is.
You can manage it better,
Yep.
manage
So,
it better.
well, I question what's the guarantee that they're doing something like that, or that could just come out or Zika breeding.
I wouldn't be surprised if the DEC officer on site had an answer for that, but I don't really know.
Did we find out for sure?
I just know that I got rid of a lot of tires last week.
Did the health department find out?
Yeah.
To the landfill.
Yeah.
I think we should know whether or not that's a breeding ground for Zika or they're under compliance like that.
Absolutely. I mean, they made a request that we don't come anywhere close to that from now on, until this is dealt with, so that's what we did.
Thank you.
Mr. Cronenberg?
I'm concerned about the open ditches and town roads and the county roads, that have open water. And the drainage ditches alongside the road. I know Noble Road, the town did just excavated it out. And I had one of the neighbors up there said, what are they gonna do about my Zika ponds out front? He was being facetious, but I'm wondering if the county highway department or the town highway departments, to treat that, or are they responsible for treating it, or, it's a big source of standing.
Keep the water moving.
But what do you do when you've got swamp out in the hedgerows,
Right.
out in the field, there's a lot of it?
Right.
That's why I question this tire process here, this procedure of not having so many tires. Is it really just a drop in the bucket of where mosquitoes can breed?
It's not a Zuma Wildlife Refuge been where it is?
They spray systems.
We do what we can, but really, it's probably much more than we can control just a few tires, but scary.
Thank you for bringing that issue up, Mr. Churchill. Very good discussion. Is there any other unfinished business before this committee? If not, we're adjourned.